My name is Dr. Jeff Kazaglis, and I'm one of the orthopedic surgeons with OrthoIllinois. The anterior cruciate ligament is one of the major ligaments of the knee, and it has two main jobs. One of its main jobs is to provide a central pivot point for the knee to allow us to cut, turn, and pivot when we change direction during sports. The other thing that the ACL can do is prevent the leg bone from coming forward on the thigh bone. The ACL is at the center point of the knee. It's surrounded by the cartilage and the meniscus. There's four major ligaments in the knee. There's the anterior cruciate in the front, the posterior cruciate in the back, the inside has the medial collateral, and the outside has the lateral collateral. There's a couple signs that are very characteristic of a torn ACL. One of them is you'll feel a pop in your knee. Sometimes the pop is so audible that people playing sports with you can hear it. The second thing that happens is the knee will swell up. If your knee doesn't swell up, you did not tear your ACL. The reason that the knee swells up is that there's blood vessels that surround the ACL, and when you tear the ligament, those blood vessels bleed and make the knee swell up. The next thing that happens is the knee will feel unstable or wobbly, especially if you're jumping, cutting, or pivoting. The knee will feel like it wants to give out on you. Finally, there'll be some pain in the knee. Our bodies have a certain potential to heal, and the ACL cannot heal once it's torn. The reason that it really can't heal is because its blood supply tears when you tear the ACL itself. Number one is basic first aid. You should put some ice on your knee. You should wrap it with a compressive wrap. If you have access to a set of crutches, you should get crutches. And finally, you should seek orthopedic care at OrthoIllinois. We have Injury Express locations open 7 days a week where you could be seen and evaluated. If we're concerned that someone's torn their ACL, we'll normally examine the knee and check certain tests that are commonly associated with an ACL tear. If you watch an NFL football game, when you see a football player fall to the turf or to the grass, you'll see the training staff run out on the field, and invariably the trainer will grab their knee and start pulling on it. What they're actually doing is a very common test called a Lockman's test, which is the #1 test to check for an ACL tear. If you feel the leg is loose when you're testing the bones, that's a sign of a torn ACL. More commonly, surgery is involved for an ACL tear. Less commonly, attempts could be made to treat it non-surgically with physical therapy and a brace. The difficulty with that is if you desire to return to the same activity level that you were doing when you tore your ACL, it's hard to do that if the ligament is not restored. If you'd like any additional information about ACL or anterior cruciate ligament tears, or you have any other sports medicine related questions, feel free to reach us at orthoillinois.com.